Good afternoon, everybody. I want to thank you for joining us here at Prince George's County OIT. Our next session is on the healthy foods area priorities. And speaking to us today is Ms. Alison Mendoza-Walters, who is a health planner here with Prince George's County.
Hi, thank you so much. Thank you for allowing me to present. I'm not sure if there's folks in the room, but if you have questions at any time, feel free to go ahead and unmute yourself. We're a smaller group, so feel free to go ahead and unmute yourself and ask those during the presentation. We can make it more conversational. I'm, as mentioned, I'm here to present on the Prince George's County Healthy Food Priority Areas map. So before I get into the GIS aspects, I'd like to give a little background on the legislation and community groups that laid the foundation for the formation of this map. So in 2018, the Food Equity Council and Healthy Eating Active Living, or HEAL work group of the Prince George's Healthcare Action Coalition, as a group of partners working on community health, decided to map out where the healthy and unhealthy food retailers were in the county. So that was decided back in 2018. And so they were looking to map healthy food options as well as food swamps. And food swamps are areas with too much fast food and too many unhealthy options. Shortly after, in 2019, this work was accelerated by the passage of state and county legislation. So the state passed legislation enabling the county to administer tax credits to grocery stores that establish themselves in these healthy food priority areas. At the same time, there was a food truck bill that gave food trucks fee waivers if they vended in these healthy food priority areas. So that was in 2019. One challenge was that these healthy food priority areas hadn't been established yet. So there were legislation allowing for tax credits and legislation allowing for fee waivers to better offer the residents of Prince George's County healthy options, as diabetes and other chronic diseases are a big issue in our county, but we didn't have the places where these credits and incentives could be exercised. And so a group of stakeholders came together, the Food Equity Council partners in the Prince George's Healthcare Action Coalition, as well as a number of county agencies. OIT played a big role. Other folks in the health department were brought in. For example, Department of Public Works and Transportation and Planning. We all came together, and how are we going to map out the healthy food priority areas? One of the biggest challenges was finding a data set that was updated and regularly maintained of all the food stores in the county. So some folks may be familiar with food deserts. The USDA put together a food desert map. And that map is based on 2015 data. So if anyone has been around the county since 2015, you know a lot has changed. The food desert map also only includes large grocery stores, so your multi-department grocery stores, and also folks that have been around the county know that we have a lot of international markets, a lot of smaller food retailers that sell a lot of fruits and vegetables, but weren't necessarily included in that food desert map. And so we did some research to find where can we get a list of all the addresses and types of all the food retailers. And we came up with our food inspectors list. So anyone that sells food in the county must get a food safety permit. And so we spoke with some of our health department folks. We've got a lot of divisions and programs in the health department, so that the food inspection is not my particular division. But we brought on a colleague from the food inspection folks. We looked at that database Now, that database, it is made for the purpose of food safety, not for the purpose of mapping out healthy food routes, where if the food is healthy or unhealthy. It doesn't matter if the food is safe, which don't always overlap. So there had to be a lot of cleaning and working of that data set. There were over 3,000 data points that our colleagues went through line by line to categorize something as a grocery store or a fast food. There were some preliminary categories, but they weren't consistent. So we had to work together to define categories. For example, what constitutes a carryout versus a fast food versus a restaurant versus a small market, large market, etc. And so there's a lot of, once you really dig into it, there's a lot of nuance. So figuring out the categorization scheme took some work. And then, of course, there was the data cleaning. So once we had the data, the putting together of the data was the lengthiest process. I think the map came together in just a few months, thanks to our colleagues from OIT. So in order to look at which areas of the county needed healthier options, as you folks know from working with data, stuff is usually divided by census tract. And so we know from looking at our public health research and our public health literature that people with lower incomes generally have a harder time accessing healthy food. And so we looked at income, but we didn't look at the poverty measure. Because as you know, it's really expensive here. So someone could be like 5 or 6 times the federal poverty line and still be really struggling in this area. So we didn't want to go specifically on the poverty line. Instead, we used the Maryland self-sufficiency standard, which was put together, I think it was the University of Washington. But it factors into account the real costs of living, housing, food, gas, transportation, bills, childcare, things of that nature, things that the federal poverty line doesn't calculate per per area. And so we looked at that in 2020. The Maryland self-sufficiency standard for a family of 4 was about 67,553. So in order to make your basic ends meet, a family would need to make at least $67,000. So that's where we cut the line of low income. And so our GAS folks help us pull the census data, sort it out to below 67,553 and above, and kind of highlight those census tracts that were below that threshold. Another thing we know from the public health research and literature, and just kind of by common sense in general, is if you don't have access to a vehicle, it's going to make it harder to go buy healthy food. Even if you are able to use public transportation, you still have to lug it. I know my family, we go to Costco and we get a whole bunch of our stuff from Costco because we have a car, and that's just not really feasible. You've got to lug all that stuff on the bus. And so we looked at vehicle access. This was, again, from census data, the American Community Survey, a 5-year estimate. And the median amount for Prince George's County residents to have access to a vehicle was 5.2% of households. And so if more than 5.2% of households in a particular census tract did not have access to a vehicle, then we lit up those census tracts as well. So we had the income, lit up those census tracts, and then the ones with low vehicle access lit up those census tracts. And so then we had to deal with how do we determine out of these 3,000 food establishments what places are healthy and what places are not, and what places are in need. And so out of those 3,000 food establishments, we couldn't go in and into the actual store and survey what they had. This type of map had been done in Baltimore City, and they had actual students go into the grocery store, go into the market, and take stock of what items they had on the shelf. That is a very cumbersome process. We didn't have resources for that. So we said, okay, if something is a grocery store or an international market of medium size, or even a small mom and pop market, we are going to assume they sell some amount of fresh food. So grocery stores, mid-sized markets, and small-sized markets. If something is a fast food or a carryout or a dollar store, we're going to assume that it's generally unhealthy. Of course, on both of those sides, on the healthy side and the unhealthy side, there are exceptions, but for the purpose of using the data we had with the resources we had to make some general categorization. So healthy foods were grocery stores, large ones, mid-sized grocery stores, and mom and pop markets, and then the unhealthy ones were carry-out, fast food, and dollar stores. And what we actually did was took the ratio of healthy to unhealthy food retailers. So if there were more than 4 unhealthy stores for every 1 healthy store, that census tract was lit up. So once again, 3 main criteria here, being below the income threshold, having low access to a vehicle, according to that census data, and having a low ratio of healthy to unhealthy food stores. And so any of the census tracts that met all 3 of those characteristics, they're the census tracts here on the screen that are defined as healthy food priority areas for the first round of the map. And then what we did was vet this with our county council, and municipalities also had a chance to look at it. And our representatives down in the southeast of the county said, you know, we have really limited access, but their census tract didn't quite fit these measures. And part of it is because, you know, inner beltways are really urban areas. And then in the southeast part of the county, it's really rural. So I could have, if I just take this area in Laurel, I could have 3 grocery stores in this area, and I can deem it kind of accessible because it's a small area and I have 3 grocery stores and maybe there's not too much fast food there. If I have 3, and there's not even 1 grocery store here, I don't think. But even if I did have 3 grocery stores, you know, some people smile. I don't know if folks are from down this area, but if I had 3 grocery stores in this census tract, you know, even if there's 3, there's still a problem with access because it's so rural. Everything's so far from each other. So sometimes the measures, you have to ground them in reality and what the context of that neighborhood looks like. So we said, okay, the you know, measures on paper didn't deem this area a healthy food priority area, but the reality is it's such a rural, it's such a spread out area that access is really a challenge. So then we added that area. And so in conclusion, I wanted to leave time for questions. So here we have our healthy food priority areas map. And we have the overview here. This is a lot of what I talked about at the beginning of the presentation. If you are a data wonk, you can click on this methodology and metrics tab. You can look at the data sources. For example, use a 2014-2018 American Community Survey and estimate our retail food environmental index as a ratio of those healthy to unhealthy foods. That was based on, that was an adaptation of a Centers for Disease Control measure. And then we have just our food definitions, what makes a large grocery store, what makes a medium one, and what makes a small one. And for folks' references, we have the grocery and fresh food locations listed here, and we have a lot of layers on this map. Since this was first launched in What is that? I think 2020, the whole last 16 months is blending together. But we have been able to talk with various partners, including the Economic Development Corporation and Capital Area Food Bank, about what other data would be useful. And so EDC, the Economic Development folks, the people that try to lure these grocery stores in here, said it would be helpful if we could see the metro lines, where the public, for transit-oriented development, and if we could see all the food facilities, so all like 3,000 are on here. So if I'm a retailer and I want to build something on, and I'm just going to make something up, Greenbelt at 193 along the BW Parkway, I can see what the food landscape is there. And we've got a number of other layers here. We have our council managed districts for our county council, so they can see what's going on in their district. Bus lines. These are bus stops with a quarter-mile buffer around them, so the areas that are theoretically accessible for an able-bodied walking person to get on the bus, metro lines, etc. And we are continuing to have conversations about what data would be helpful on this map. And we are exploring with our public health partners as to what else can we do in these areas besides grocery stores and food trucks to get more healthy options. Because the grocery store is a solution, it can help, but it is not the solution, and it is not a cure-all. So right now we're in exploratory conversations about identifying a vacant, unused county lot and seeing if there are farmers or nonprofit organizations interested in cultivating those lots into urban farms or community gardens. Very early exploratory stages. There's a lot of agreements and legal stuff and MOUs that need to take place. But we're just hoping just to build more initiatives in these healthy food priority areas so we can have a grocery store and the community garden and maybe some health educators, because one thing is not enough to solve this very complex problem of diabetes and food access.
Thank you very much. I'm monitoring, and we do not have any questions at this time. However, I do have one.
Sure.
Reference to COVID. Now, we're lucky enough. My wife and I are both. My wife works for the county. I contract with the county, so we've been lucky enough where we weren't laid off and had any of that issue. And we have done some of the not only the curbside pickup from the local grocery store, but also some of the delivery services. Have you noticed and gotten any more updated data to see whether COVID has had any effect on this or not?
So we do not have updated data yet. We are waiting for the 2020 census data, which we hope comes out at the end of this year, although as you folks know, there's been some delays with the census. So we want to look at the new census data as well as pull the food permitting information again, because there may have been stores that unfortunately had to close. So I don't have the hard data yet, but just anecdotally, the landscape has changed. And then, we have this income threshold, and of course, incomes in the region have changed. So I imagine there would be some changes, but we won't know yet until all of that data comes in. We'll also look at our methodology to see if there's any other data layers we're missing. The Capital Area Food Bank has done a calculation on food insecurity, which is a little different than healthy food access, because food insecurity is access to food in general, but a lot of times it overlaps. So we'll talk with some of our partners as to what data they use for their maps and see if we need to tweak this for our map update, which is hopefully going to come out next year.
Okay, great. Looking forward to that. You mentioned the very southeast of the county. I happen to live south in Charles County, and I can think of one small market that's probably in that area. I can't think of many more. Um, at that point, you either have to go all the way up 301 a ways towards Rosaryville, or come down the Waldorf, or even in. I mean, there are some things in Brandywine, but yeah, there isn't very much down there. You also mentioned about getting, setting up something on a vacant lot. That reminds me, there is a food co-op in Greenbelt that I believe is still active. Also, I actually worked on getting some of those points set up and massaged for the map. So I know what you mean by when you're talking about all the mass amount of data that was out there and having to get it trimmed down. I mean, I guess that would be, something that could be emphasized. There may be some areas that would be interested in starting one of those up, especially in these older or these outer outlying areas, or especially in the inner beltway.
So
Yeah.
I'm sorry, go ahead, Allison.
Real quick, we have a list of, there's a lot of vacant lots, so we kind of talked to some folks in the government to trim down that list to places where it may be more feasible. So we have a list of about 50 to 60 potentially feasible lots. It's in a spreadsheet. So our next step now is to try to overlay that on this map to see which of those properties, if any, fall within these healthy food priority areas.
Allison, I was curious, and first off, I wanted to thank you for your work. There's in GIS, we always the best projects and our favorite projects are the ones that are impactful, that we feel are impactful to the community, and yours obviously is. And these healthy food priority areas help to draw attention and highlight a real problem. I have two questions. First off, the areas that you developed, have they led to formal policy, any policy initiatives? I don't know if you could speak to that.
Yeah, this actually came a little in the reverse order, as I mentioned. So we had the policy initiative, which was the tax credits for the grocery store. So we had the policy initiative because there was an awareness that there were areas that needed more access to healthy food. But we had a policy initiative before we had the map. As far as new policy initiatives, I hope that we have more things going on. We'll see what happens with this project with the vacant lots.
Mm-hmm.
We'll kind of see what else comes out of it, but not yet. But hopefully some to come.
Okay, yeah. Sometimes the policy can come before the map. Nothing wrong with that, as long as the map gets done. And then I was curious about lessons learned. Now that this map and this effort is has a few, well, actually years into the effort. Someone else who was just getting started in a similar project, what advice could you offer them?
I think the partners were really important. So as I mentioned, I work at a health department. We've got hundreds of employees, so I'm not privy to the food inspectors. I didn't even know it existed. And so I think it's important to tell people what your goal is and what you're aiming for, which is what we did in the coalition. And then, through a series of how about this and how about that, and you try this person, that's when we got connected to the food inspector. OIT was amazing. I'm relatively new. I've only been in the health department 2 years, but when I first started, I didn't know we had an OIT. I didn't know what their capacity was. And Patrick was amazing at OIT and putting together this dashboard and everything. And so those partnerships, and then we had community organizations on the ground dealing with food equity to kind of inform, what should these measures look like? When we talked about the income measure and talked about poverty, that was one of the big conversations we had. What does it mean to be low income in this region.
Right.
And so the partners were really key. At the same time, you kind of need like someone driving the train, because we had a lot of opinions, we had, I don't know, a lot of ideas about measures and metrics, and we eventually just had to kind of narrow it down. But we needed all those perspectives in order to land on these 3 that we ultimately landed on.
Yeah. Thank you.
Okay, well, I certainly don't have anything else. It's been very enjoyable. I learned a lot, and I want to thank you again so much for stopping by and having this discussion with us.
All right, thank you. Thank you for having me.
Thank you, Alison.
I'm happy to answer other questions offline.
We will make the recording available for the rest of the conference as well for some time to come.
Okay, thank you so much. Have a good afternoon.
Thank you.
You
Bye-bye.
too. Bye-bye.